I'm going to squeeze in there just to get it kicked off, then I'll back out. And Ryan's going to start our recording if you'll start yours.
Are you ready?
Ready, Ryan? 3, go ahead. 3, 2, 1. Hey, everybody. Welcome to Hyperbaric Plus and our weekly show with my buddy here, Keith Bishop, with PrevailOverCancer.com. Keith, I've had a lot of people coming to me with kidney issues, and we've talked about it. I've sent several to you, and we're starting a little program where Keith, being a clinical nutritionist, is going to be able to follow their journey and watch their labs. And I don't know if I've shared the whole thing with you, but I've got several people that are willing to take this to the next level. They've hit a plateau with their medical doctor. And so we're marking all their labs and how many times they dive and what else they're doing. We've been talking now about red light therapy on the kidneys. And it's all about circulation.
Yes, that's right.
So we're going to start, and we're looking for some clients here in Oklahoma City that we can work with. The clients, I've got about 5 of them. They want to monitor this. They want to monitor their labs. They want to monitor the cost of hyperbarics. And they're going, a couple of them are headed to dialysis. And so if we can keep them from dialysis, what are the costs of those two things comparatively?
Right.
They're crazy different. I mean, I've got one gal that's 2.5 years into this that her numbers today are better than when she started, and she was on her way to a dialysis clinic.
Right.
And her numbers today are better, and it's fun now that we've got it on a spreadsheet.
Right.
You can see the dips and valleys and mountains and what happened here. And she goes, well, that's when I quit paying attention. And now that she sees it on paper, we're making a little game out of it. And we're going to see how much,
Some accountability.
how much we can make these numbers come together.
Right.
And we're going to turn it over to insurance. And when I say my client with their insurance is going to document all this. And hey, the medical community was done. They were going to go to dialysis. And she's paid out of pocket to do all this work. So that's why we have insurance. And if we can show on paper that, hey, when I started this, I got better, then we're going to start down that trail. There's, in fact, Jake Merritt, who's running for governor in Oklahoma. He spoke, and I got some notes from a wellness group that he spoke with. And his whole desire is to make the insurance companies start paying for some of these off-label, what they call, I hear chicken feathers all the time.
Okay.
But meaning things that are not recognized by the medical industry, they're off-label. If we can monitor that and show progress, can we get our insurance to reimburse us? I mean, that's why we have insurance.
Right.
So there's a push here in Oklahoma to do all these things, and I'd like to beat the drum and kind of lead the way. And I've surrounded myself with the right people, I think. And I want to start this process, and you come on board to help me with it. And so anyway, that's what we're going to talk about today. We're going to kind of start off with kidney function, and with all of that up front, now you know what our ulterior motive is.
You know what his passion is.
Let's let Keith get started on it. So thanks again, Keith, for being here.
Thank you for tuning in. And so, this is, kind of off topic of what a lot of times I'll talk about is cancer type items. But actually, I have several clients with cancer that have kidney problems, and they maybe had kidney cancer. They lost a kidney. Some people lost a kidney. They don't know why it disappeared. And then, but also this is like Paul mentioned, it's about circulation. So we have to do everything we can to improve circulation. By the way, if you have questions, submit those questions to us, and then we will answer those questions. If we run out of time, I will also reply to the questions online. So we'll post this online after the seminar. And by the way, my seminar notes, this handout are also on my website, on my learning center. It's called at PrevailOverCancer.com, and then the Learning Center tab down toward the bottom of that Learning Center. I have a lot of free guides on there. So kidney function. Actually, most of us are going to have problems with our kidneys. As we get older, it's going to happen. As our body ages, circulation decreases. So some people are going to have heart disease, atherosclerosis, heart attack. Some people are going to have a stroke due to plaque buildup in their brain. Some people are going to have neuropathy due to poor circulation to their feet. And there's some common causes to that, and some of that is going to be things like diabetes and blood sugar levels. Elevated blood sugar, can contribute to damage to the lining of the blood. And you grill that, and it gets that sugar crystallizes. That's what actually is happening inside the blood vessels. It's crystallization inside those blood vessels. Matter of fact, that's actually what the A1C measurement is. A1C is actually damage to the red blood cells, and they're measuring how much damage to those blood cells. The higher the number, the more percent of damage to the red blood cells caused by blood sugar.
And obviously it's reversible.
Yeah, and
that's why you
yes,
monitor it,
exactly,
so that you can get back on task.
And blood sugar it does change, and we can get that better. And the kidneys, and I've been doing this for a long time, and so I've been helping people since 1999, and root causes. We were talking about that when we were in the chamber. We got to address those underlying things, and we're going to talk about that too. So, assess and don't guess. So this is what's nice is that the GFR and the creatinine blood tests are a couple of basic tests that are available. If you were to get that blood test at a lab and pay cash for it, it's like $20, $29 after the lab draw fee. It's simple to get. Then you follow up and make sure that's working. The goal is actually to see, within a month, to see a little bit of an improvement. I'm going to prep Josh a little bit, so he actually knows that a person had, some dramatic improvement with a little different type of a protocol. And so, but to follow up with that blood test for that, without it, we don't know how things are going. And if it's not getting better, then we just have to say, okay, well, what else can I do? Because there's always going to be more. And matter of fact, we're going to touch on a lot of things today. And the goal is actually to do a few things, test, assess, and then adjust, for that. So also, this is not necessarily, it's not always going to be a remarkable 1 month treatment. This is not a medication that's going to heal you and cure you, but it's going to be a more gradual type thing. And so it's a long play.
I think the important thing is that you're not treating the symptom, you're treating root cause. And so it's not going to be that immediate aspirin response. It's going to be a long-term healing response.
That's correct. So this is long-term. This is the long play. And so the goal is, so I want to see with my clients that GFR number, I want to see that GFR just kind of, gradually get up better. And it can increase quickly. But the problem with that is that, it's, when a person has a tendency to drop off the wagon, and start ignoring things, and it's going to go right back to where it was.
Kind of like weight loss.
Well, like weight loss. We can do good for a while, then we kind of quit. That's going to be the purpose of doing a frequent blood test, so that how things are going.
But what we were talking about in the chamber is we know those things that we want to look at. We go back and look at our blood work over the last 10 years. So what is the trend?
Yes, right.
And if we see the trend coming, don't wait until they want to put you on dialysis.
Right.
If you see the trend,
yes,
change now so that it's easier to change now than when you're in deficit.
Yes. And so also, I don't want to mislead anybody. So this is also it is a gradual change and improvement, and there can be enough scar tissue, fibrosis, and damage occur that the kidneys may not fully recover. And so the goal is to get better, with that. And so it's kind of like a broken bone. If we break a bone, that bone, no matter what our age, even in a very senior citizen person, can heal if we can provide the right situation, splint that, and improve circulation. Once again, even for that broken bone. And then actually that spot is going to be stronger and better than what the rest of the bone's going to be. It's going to be stronger. So, matter of fact, it even looks different on the X-ray. But so the kidneys can get better. I don't want to mislead anybody. So it's not a total healing and then you just forget about it. So this is more a long play. And matter of fact, every single thing I'm talking about is circulation and healing, and various different aspects of that. One of the things we also talk about in the chamber, we have so many good topics, but it's more like we have to keep doing many different things and keep making changes on many different things. We don't have to be perfect, but we have to keep making those changes. So let's see here, address those underlying issues. I've got a link also to a lab source. Actually, most states in the United States allow for blood tests to be done without a doctor's order. So also, before I forget, so I do have a disclaimer at the bottom of this, but I'm going to be talking about supplements, and so supplements are not intended to diagnose or treat health conditions. There's an FDA disclaimer on that. I want to throw that out. And then also, before you make any drastic changes in your healthcare program, work with your healthcare provider. They do have some information. They may not know everything we're going to be talking about today. They do know some things, and throw that out there, for them.
The reason we do this, Keith, is to get that information so we can ask better questions when we see our provider.
That's right. So I'm actually writing a book right now about chemotherapy treatments and how to talk to your doctors about integrating natural things. And so I've got a chapter devoted to that, how to approach your doctor for that. So, okay, so common causes, and therefore areas that we want to address with that includes diabetes. So that elevated blood glucose damages inside the blood vessels, and now we start getting plaque buildup, and yes, narrowing of the blood vessels. And so now whatever organ that's going to be, for some people have a heart attack, some people have a stroke, brain attack, some people have a kidney attack. And so matter of fact, one of my clients, she actually lost a kidney. It just was gone and didn't know why. But she also had some underlying vascular issues going on, and she just happened to have a kidney attack and didn't even know it. And it just disappeared. It was gone. There was like just a tiny fragment of it left. And so now she's down to one kidney. So with that, we do need to be sure and concentrate on what we're doing. So let's see. By the way, I just got to notice my same thing happened last week, so this may be cutting in and out. So be sure and hang in there and come back. We'll try to keep reposting this if that happens. And also, we're going to post this on Instagram, and also Instagram and Facebook and Rumble will be the same thing. So diabetes, we have to address that high blood glucose because it does damage the blood vessels. And along that line, actually, doctors will also prescribe medications for patients that have diabetes. They'll give them blood pressure medications to open up their blood vessels, once again, to protect their kidneys, but it opens up the blood vessels, the way those blood pressure medications work. And then so myself, actually, I have a genetic issue with that. I actually have a difficult time making some of those blood pressure chemicals that help open up my blood vessels. So therefore, I have to take a supplement for that. And so that increases my risk of kidney disease. So, and other vascular things that, my family has challenges with. So vascular disease and hypertension. So high blood pressure is one of those risk factors. So high blood pressure, if you weren't taking, or if you are taking blood pressure medication. So even if you're taking blood pressure medication, that is still a risk factor. High blood pressure is a sign of some plaque or kidney issues, not making those blood pressure chemicals appropriately. And so that means poor circulation, excuse me, poor circulation and creating perfusion. We got to get nutrients into those cells. So throughout the body, one of the things I look at when I do a physical exam is I look at a person's legs, and a person's as we get older, the hair that's growing on a person's lower legs keeps becoming less and less and less. Some people, so we're going to look and see, has a tendency to become less and less because circulation is getting less and less and less. So those hair follicles start dying out. So the lower part of your leg, and it just keeps getting worse. So, but same thing happens, if we can open up the blood vessels throughout our body, hair can get better throughout our body. There's still Some of us have more problems in certain areas than the rest of us.
I would say too, don't, we talk about these healthy things you can eat or supplement to do it, but there's also no replacement for just even moderate exercise. Don't be sitting all day long.
Yes, that's right.
Just you move and it will help.
That's right. So, and most of you that have had my online sessions have noticed that I'm usually standing during the appointments. I have a standing desk. It goes up and down. But I'm usually standing, to just be more physically active and to have better posture, versus kind of slumping down in a chair. So it's easier for me to do that. So yeah, matter of fact, that's part of the diabetes issue too, is that we have to be physically active, especially after we eat. So in the United States, our biggest meal is typically dinner at night. And what do? Sit down and watch TV. That's the worst thing that we should be doing. We should be actually up and walking, working, doing things. But we're probably eating the wrong meal. They're too big. So if anybody with blood pressure issues, that is a risk factor for kidney disease. So we need to be addressing those underlying issues with that. We're going to talk more about how to do that. Inflammation, oxidative stress also is an issue. So when we talk about things, ways to address that, but inflammation is irritation. So think of it as pain, really. But that pain can happen in organs and we don't feel it. But that pain and that inflammation, literally damages parts of the body. So, and it doesn't make whatever part of the body it is. HSCRP, actually, that is a risk factor for this. And I didn't mention that and put it on this lab test, but HSCRP is a high sensitive C-reactive protein blood test. If it's elevated, that means that there's vascular disease going on. Actually, it's the best indicator of a pending heart attack for a female, because women don't have the same type of chest pains that a male will have. But an elevated CRP measures inflammation inside the blood vessels. So that actually is a great tool to evaluate that inflammation and your response to anti-inflammatory and oxidative stress. So, corrections on that, include eating better. We're going to talk a little bit more about that. Antioxidants, like my favorite, NAC, N-acetylcysteine. Yeah. So, Ultra Botanica, they love that product, and I do too. And so, and then also weight management. So, excess body fat also makes inflammation. Inflammation, is a driving force of irritation inside the blood vessels, increased risk of heart attack, strokes, kidney disease. Nephrotoxins or kidney toxins and medications. So certain medications, I actually have known several people over the years that actually had kidney disease because they were taking an arthritis medication. So non-steroidal anti-inflammatories, things like ibuprofen, naproxen, and prescription drugs. Matter of fact, some of them were pulled off the market because of things like this. And so that they were very popular at one time. So NSAIDs, anti-inflammatory drugs, can be an issue, even in some antibiotics, very well known. Sometimes we have to do those things, or we were given those things, and maybe we do have some issues, but we got to address that now. So even contrast agents, for scans can be an issue and create some injury for some people. And to correct that, we want to make sure that we're drinking plenty of fluids and try to do other alternative type things. For example, instead of traditional anti-inflammatories, I will take curcumin, on a regular basis, and a major anti-inflammatory. And it's amazing. I occasionally don't take it, and I can tell the difference. I'm a little more
bound to NAC is really an amazing. Chronic. Well, I can't say
how you say that.
I'm not sure how you say it, but what I normally tell people is you notice what you don't notice.
Yes, that's right. And so whenever I stop taking it is when I realized, hey, it was really helping, with that. So some things, we have to be careful of how we say some things due to government regulations and such. And then there's also just aging. As we're getting older, I mentioned this earlier, our body just doesn't function as good, head to toe. Everything doesn't work as well. And then there's genetic issues. And so I'm at a higher risk due to some genetic type things. Therefore, I do monitor my blood pressure and found out that, matter of fact, 40 years ago, my blood pressure was fantastic. And, I had no worries or cares. And now I do have to monitor that. And I do have to take several things to help me with that, to open up my blood vessels. Even though I'm lean, I seem to be doing everything right, but I have some genetics that I have to overcome. So it's not just the outright physical things going on. So we're going to switch gears. And so those of you that are tuning in, I have the handout on my website at the prevailovercancer.com on the Learning Center. And then, so now we're going to talk about, some ways to help improve this. So that's what most of us want information with. Well, also, even though if you do have a health challenge or a cancer or major issue, most of us are, as we're going to get older, are going to have some kidney issues, or somebody's going to have kidney issues. So all of these things are things that we can do, even at just moderate levels, to help improve our kidney function. So, so there are actually, I was told about this a couple of weeks ago, but there's interesting studies, and actually traditional, and so traditional is kind of a weird term to use, but traditional medicine, what I'm talking about is traditional medicine. It means 2,000 years old.
Yeah, 5,000.
5,000 years old. Now, we're not talking about, in the United States, we call traditional medicine prescription drugs. That's wrong. Okay, that's newer medicine, and that's medications. That's not traditional medicine, which actually in the United States is only 250 years old. So folk medicine, and old-fashioned and or Native American medicines and things like that. So are a lot of great options. So so anyway, so this one has to do with camel milk. So do you want to share a little bit about that?
Yeah, I mean, I don't.
I was
This
not
isn't any
aware of that.
research that I had done.
Well, there
or
is some
anything
research,
else.
yes.
Yeah, there's a lot of research out there on it, but this particular protocol was shared with me by a 76-year-old man that was at the point he discovered this was 4.75, stage 4.75 with CKD, and they wanted him to go on dialysis, and he refused.
Mm-hmm.
And so they referred him to an end-of-life coach. And his wife found this 5,000-year-old Arabic thing. And it was the camel's milk and tart cherry and tart blueberry, corn silk, and cumin seeds, black cumin. And over the course of a year, he completely reversed his kidney disease. And it was weird. So, obviously not making any recommendations, but have shared that with a couple of other people, and people have had incredible results. And it's just, but if you go in and start looking, you'll find some interesting studies out of Iran and some of the other Arabic states that are talking about this, that have shown it to have efficacy supporting kidney health. I shared it with a nephrologist who was dumbfounded when he started looking at it, and then really dove deep into it and started finding local sources of organic camel's milk, and so it's just one of those things God gave us that seems to have some positive potential.
Right. Yeah. So, matter of fact, yes. And so, yes, there is actually research supporting that. And so matter of fact, my wife told my wife about this, and so her family history of actually with blood sugar issues and kidney issues and things like that. So she said, "How do you milk a camel?" And so, and actually, here that's right. It's not a native animal, So, but there are chemicals, in that, and probably what we would call peptides.
I haven't even delved deep into any of the chemical properties of the camel's milk. I have on the other things, but
so it's not a common thing. It's hard to find and hard to milk that camel. So we've seen them; those camels are pretty leggy, and they will definitely kick. So, but anyway, so but in certain regions of the world, it is available, and they do use that, and they do make food products out of it. Not always just the milk itself, but they will also, use it and make fermented dairy.
Oh yeah,
products.
And even the camel's humps, it's a delicacy. There's, I mean, if you get into it, you'll discover, and you might pay attention, because there are little little areas that you'd never guess. There's a place outside of Kansas City that has organic. They've got camels and they
Really?
produce organic camel's milk.
I need to take my wife
There's
there.
a place in Owasso,
So,
Oklahoma
okay.
that
Oh, well, closer.
that raises camels and
Mhm.
they provide milk. So there's, you know, if you get out there, you'll find it.
Okay. Okay. Well, we need to make a trip up to the Owasso Rams and go check that out. So, so I have that protocol, and so what this gentleman did was the camel's milk and tart cherry extract. We have to be careful about cherry liquid, and so actually there can be a lot of potassium, and so as the kidneys are failing, if they're not working right, potassium, the body, they cannot get rid of the potassium. Potassium can become elevated. So we have to be a little bit careful. So it's moderation, no matter what it is. You have to be careful with moderation, for example.
And
You know,
stay hydrated.
Stay hydrated to flush, flush chemicals out. Blueberry, antioxidants and anti-inflammatory. Tart cherry, also antioxidant and blood pressure. Corn silk, also anti-inflammatory, helps to lower uric acid crystals, calcium crystals. Those are physical things that can happen. Besides atherosclerosis, there could be physical things happening that increase that risk. And there are food choices that also allow that to happen. So, and uric acid has a tendency to go up because of elevated blood glucose is the number one issue. I've seen that time and time and time again. Matter of fact, Dr. Perlmutter, I think he's one that has a book out. It's called about dropping acid or something like that, but how to decrease your uric acid level by bringing your blood glucose down. And he's big into that because of dementia. Alzheimer's is called diabetes type 3. And uric acid is one of those things. If it's going up, it's because of a need for either antioxidants, the body's trying to repair itself, and or elevated blood glucose on that. So, and then also vitamin D3 and K2, some of my favorite supplements. Matter of fact, actually years ago, 20 years ago, I had a friend that had type 1 diabetes, and therefore he was having to start going into dialysis. And so he said, Keith, what do I need to do? And I said, well, according to the research, and I wrote a little white paper for him to give to his doctor. I said, you need to take vitamin D3. This is before we knew K2 would be important, but take D3. And the doctor freaked out and said, no way. You can't take that because it was not an accepted protocol. Well, it is now. And so actually vitamin D3 helps vascular. It actually helps the kidneys to make blood pressure medications so that it will not have as much problem with the kidneys. So vitamin D3 is important, but you have to have a blood test. You have to assess and don't guess. That's why I have this little caret symbol on the handout and referring to go back and get blood tests on that. We also have blood tests on vitamin K now. And matter of fact, so far, every person that I've had a vitamin K blood level is actually low. I've actually been very surprised about that. So they're low in that. So anyway, so the vitamin D3 dose goes anywhere from 2,000 to 5,000 average dose, and some people need more. My wife, she has to take 7,000 a day, to keep her blood level up where she's supposed to be. If you don't test, you don't know. And vitamin K2, actually, 100 to 200 micrograms a day is actually usually a very safe dose. I have some of my clients with very severe atherosclerosis. I'll give them higher doses and like 500 micrograms a day to help pull calcium out of their blood vessels. And so, matter of fact, I've seen that actually with carotid arteries, literally within a couple of months, a 50% improvement in carotid artery plaque by doing these type of things. So, and then magnesium, I prefer glycinate. That's very well absorbed. Citrates sometimes can be irritating to the stomach and or create loose stools, but magnesium helps vitamin D work. Is required to make for the kidneys to make the active ingredient that comes from vitamin D3. And then magnesium relaxes the blood vessels. When the blood vessels relax, they do this, they're bigger. That means better circulation throughout the body, including the kidneys. And then NAC, we've mentioned that already. N-acetylcysteine, NAC, helps, it's an antioxidant, helps with kidney repair, helps it detox and get rid of toxic chemicals. Sometimes toxic chemicals can be a factor, for kidney issues. The dose can be anywhere from 600 to 1,200 milligrams twice a day. If you have cancer, though, be a little more cautious about that. if you are doing radiation and some chemotherapy drugs, it might actually decrease what those treatments are doing. So we have to be very careful about that and have the right timing for it. Urolithin A is a kind of a newer type item. It's a chemical our body makes, our gut makes, the bacteria in our gut makes that from elagitannins, from chemicals from teas and beverages and nuts and seeds. But if you don't have the right bacteria in your gut, you're not going to make it. And so Ultra Botanica is working on a product, to bring out, to help out with that, to help with the absorption of it. Are you binding that too? Is that right?
Yes.
A protosorb type product?
Yeah,
Okay.
we're binding it to a couple of different things,
Okay.
depending on the target.
So urolithin A also is another anti-cancer for those of you that are following me. It is another anti-cancer type nutrient. It does have anti-cancer actions. It helps antioxidant, anti-inflammatory, cellular repair. Typical dose is anywhere from 500 to 1,000 milligrams a day, unless there's tricks that we do to it. I say tricks, but methods to increase the absorption of it.
Yeah, it's poorly absorbed, but you can improve the bioavailability. And it's been shown to repair mitochondrial DNA. It helps with muscle retention in sedentary and elderly in particular. It helps maintain.
Brain.
It's huge for the brain.
Yeah,
it's great.
Major thing for the brain about that. So urolithin A, I do have a blog post, I believe, on that. I take that back. Maybe I don't. I'm going to. I think I do. I think I have a blog post. I have over 50 blog posts, and I lose track of that. So
there's a naturopathic doctor that studied it for about 30 years out of the Seattle area, Dr. Robert Lamson.
Okay.
So people Google him, they can probably find some research as well about the benefits of it.
So another very important thing when I work with clients with kidney function issues is evaluating their nitric oxide level. Nitric oxide is a chemical our body makes that helps to open up and dilate blood vessels. So and there is a saliva test I do as a fasting state first thing in the morning, saliva onto a test pad to evaluate that. And as a matter of fact, I have an issue with that. Mine typically is below depleted. It's almost like zero naturally, which is another risk factor for my high blood pressure and risk for everything else that I've got going on in my body. And so, but you can, if it is low, you can do foods like beetroot juice, like a cup of it, or eat beets. Actually, celery is another great source. Some others? Celery and beets are kind of like some of the higher ones I can think of.
Let me look.
Okay, you're good. So anyway, so actually, this is if you don't mind looking it up, I appreciate it.
Broccoli, ultra broccoli, I believe is a nitrate.
So yeah, Josh is going to look that up for us because this is extremely important. Matter of fact, I even bolded it on this handout. So nitric oxide opens up these blood vessels. We can do a test for it. We can also supplement and change our food and supplement to bring that up. So, and there's also beetroot powders. And so when I do a scoop of a beetroot powder, 24 hours later, my level is at least one level higher on that test, which is actually pretty significant. And so that's very important. It opens up blood vessels, decreases blood pressure, improves perfusion through the kidneys. I've got a link on the website to that little test kit. The 25 test strips is $15, for a canister of those.
So spinach, kale, leafy greens,
veggies.
Rhubarb is an excellent source. Pomegranate is an excellent source, which is also the elegantannins.
Yes, that's right.
Urolithin A.
That's right.
Cocoa and dark chocolate, anything above 85% on the dark chocolate. Red and purple grapes, cherries, green tea.
Okay.
Blueberries, interesting.
Yeah.
Turmeric, curcumin. And then citrus fruits, and something I was listening to yesterday on a holistic course I was going through. if you can tolerate it, the peels with your citrus fruit.
Yes.
So put it, even if you were to like grind it up into a smoothie where it's not so hard to ingest, the peels are really beneficial.
Yes, the peels, and most actually fruits and vegetables, the peels have actually most of the beneficial nutrients in it anyway. So actually zesting your citrus, using those peels, very important.
And then nuts and seeds, watermelon, garlic.
Oh yeah,
ginger,
watermelon. Watermelon works in a different way, actually through a citrulline way to help improve the nitric oxide level. So this time of year we have watermelon here in Oklahoma.
Walnuts, almonds, and pecans.
Okay, so a lot of healthy foods.
Yeah, and those actually, those same nuts also carry the L-glucannins that are precursors for urolithin in the body.
Okay, great, thank you. And so, and then another area that we get into is hyperbaric treatments. And so hyperbaric treatments, that pressure, encourages the blood vessels to open up again. We keep harping on that, but we have to improve these blood vessels, open up these blood vessels throughout the body. And so I have some, and I'm not the expert in that, Paul is, but I have written down about pressure, about, typically, I know what, typically at least 50 feet in pressure. And so, but up to 2 atmospheres type of a thing.
So we go to 2.5 atmospheres on air.
Okay.
So if you think about hyperbaric oxygen being a vasoconstrictor, hyperbaric air is a vasodilator.
It increases nitric oxide.
Exactly. So you're opening it, you're relaxing the blood vessels, and in fact, everybody that gets in there looks down at their arms and goes, "Where'd those blood vessels come from?" Because they're so prominent when they're in the chamber. So anyway, real important.
Yeah, so important, and you have to do enough of it. So this is not just a one-time thing. Okay, I'm going to do this one treatment. I'm going to do this, eat this one food or whatever. This is we don't need to become consumed about it. But if you have major kidney problems, you've got to be going in and doing these things actually on a regular basis, a few times a week. So once a week probably is not going to be good enough.
And a lot of it's a lifestyle change.
It's a lifestyle, day in and day out.
It's not a treatment, it's a prescription for life.
So there's one of my clients sitting at this table that 2.5 years ago, she was headed to her first dialysis appointment. And she stopped and she started doing hyperbaric air. And so instead of doing dialysis 3 times a week for 4 hours per session for a very expensive cost, she started diving 3 times a week for 1 hour, not 4, and has shown improvement over the course of 2.5 years. Her numbers are better today than they were 2.5 years ago.
Great.
So, and when she went to twice a week, her numbers started creeping up. And so we went back to 3 times a week, and that was the magic. I mean, it was neat to be able to follow those labs and say, hey, let's get back to 3 times a week. So real easy to do, especially when I got somebody like Keith.
So
that's going to monitor.
Yes.
I want to monitor these labs. There's so much information, and I just wanted to step in a minute ago. As you're going through all these vitamins and this and that, I know when you look at labs, you're looking at things that are out of whack, and you're looking at what can I do to bring those back into.
Yes. Right.
Well, there's no way that all of us watching you today can do this.
What? Yeah, it's a learned thing. It's a learned thing.
Well, how many years have you been involved? So that's where I try to drive my clients to talk with you, because what are we missing that we should be taking care of? You got to have somebody that's knowledgeable,
right?
And it takes all the work out of it. I just want to follow your guideline. I'm not going to try to go get and be Keith, but I need somebody to be overseeing what I'm trying to accomplish. So yeah,
we're having some good results, and matter of fact, I expect kidney function to get better by doing several of these things on that. So exercise. What happens when we exercise? We get hot, we get red-faced because the blood vessels are dilating. Okay, so exercise, and matter of fact, that affects the whole body. So exercise, matter of fact, what is the best exercise? It's actually whatever you like to do. You just got to do it. And matter of fact, we need to be exercising for like 150 minutes a week.
30 minutes a day.
30 minutes a
5 days
day,
week.
5 days a week. You know, if we aren't doing that, we're not getting enough. And now, but also it depends on, it doesn't mean that you need to be going to the gym. You know, you can do these things at home. For me, even I'll take a little break and I'll actually just do, I'll call them chair push-ups. You know, I'll just take a break for a couple of minutes and kind of push up and kind of let my back stretch out a little bit, and then literally do, you know, push-ups, you know, while sitting in the office chair for just a minute or two, you know, and then get back to work. And so you can do little spurts, you know, yes, but then a 20 to 30 minute type program is ideal. So it could be a combination of aerobics one day, it could be, you know, resistance training another day, whatever you like to do. And so even if it's a struggle, if you get your heart rate up, that's what's needed. So we have to get that blood vessel going. And actually for cancer type things too, actually our body makes what are called myokines, I believe is what's called. And those have major anti-cancer effects. And there's actually some studies showing that people that exercise 150 minutes a week, those people have better outcomes than people that do chemotherapy. So exercise is extremely important.
So heart rate, everybody's wearing wearables today. And I mean, now I can monitor my heart rate on my wrist.
Mm-hmm.
So what is a gauge for heart rate without digging down into it? Because I know that changes over age and there's a lot of things.
Each person's different, right?
But what do we want to do elevating our heart rate?
So,
is there a percentage that we would use? Or?
Yeah, there is a percentage, and there's calculations online, you know, that you can do. And actually, I try to be pretty simple, you know, because not everybody has wearables. Actually, I choose not to wear one.
For RF?
And Bluetooth type things. And so I don't wear one. I do wear just a standard watch to reduce that exposure. But, and you can also do settings on those watches so that they're not Bluetoothing all the time.
But the pulse oximeter
is another option.
Should be setting handy to where you can put it on and see
Yes.
how much you're elevating your heart rate.
But if you don't have access to that, if you haven't calculated that, actually, when you're exercising and it's difficult for you to talk to somebody, you've got your heart rate up. That's what we got to go for. And so, and once again, that heart rate's going to depend on the person. So the more healthy a person is, like I have some athletes and they literally, they may be like bicyclists, and their resting heart rate is like 45 or 50. And when they're exercising, you know, at their max, I mean, doing aerobic and or weights, their heart rate only gets up to maybe 100 because their heart is actually so efficient. They're trained for that. So anyway, so what you have to do, you have to get up to whatever that needs to be to the point where it's a little bit difficult to start to talk. So if you're walking with a friend, which I think accountability is great, you know, exercising with a friend, if you have a little bit difficult time talking to them because you're breathless, that's where we're going. That means your heart rate's getting up to where we need to be. And then also, I do like also more of an intermittent, like a HIIT or HIIT program. It means exercising hard for a minute and then resting for a minute.
You actually have much more profound
Yes.
results at that.
In a shorter period of time.
Yeah.
So literally you can do 20 minutes of a HIIT program and you actually have better results than an hour all out on the treadmill. So, but anyway, so 1 minute of exercise, 1 minute of rest, and I do stretching during that, more like some yoga type poses. If you can imagine this cowboy, you know, with his boots on doing things like that. Yes, I do. And so us guys can do those. And so I do those stretches during that 1 minute of kind of recovering. And then I'll do another minute of a more strenuous exercise. And then, and as a matter of fact, actually, I just do it right in my office on the floor with a yoga mat on the floor. And I do more like body, it may be lunges and crunches and push-ups and various different things, leg lifts, all kinds of things like that. And I do 1 minute fast and 1 minute rest for that. Sauna therapy is another one of my favorites. Also, once again, you get hot and the blood vessels dilate, and with that we get better circulation. I'm going to let you read most of these. You can download this off of my website. Do you have it on your website, or is it going to be?
Ryan, are we going to? So yes, I would like to see this posted on, because here's what's going to happen. As we've been going through this, all these clients of mine that I know are dealing with this, I'm going to reach out to them, and obviously we're not halfway through this, and I think this is
No,
a very important topic.
It is. We're almost out of time.
So we're almost at, in fact, I don't see that we're going to take any questions today. I would love for people to give us their questions.
Yeah, put your questions online
Because
and
we're
we'll
going to
answer
address them next
Yes.
week. And I want to follow up with this next week. And I'm sure we're creating a lot of, I know just with my clientele, I'm seeing some eyes pop around here. And I want to take this to the next level next week.
There's a chapter in Good Energy, Dr. Means's book, that we've recommended in the past
Okay.
that's specific to this. And I can't remember the math calculation on
Or
it.
the heart rate thing.
Yeah, it's
Okay.
like your age, take away your age from 200 beats a minute
Right.
and multiply that times 0.6, and that should be your target for your 150 minutes a week calculation. But there's a whole section on this and what it means for your overall health.
Yes, right. Yeah. So we have to be physically active. So yes, I think that's a good starting point because we definitely have a lot more we need to talk
Well,
about.
the red light therapy is something I'm introducing right now to a lot
Yeah.
of my kidney people. I think it's
That's
going
right.
to be an important component. So yeah, let's stop here.
Okay.
Keith with prevailovercancer.com. I can't tell you how much I appreciate getting into these topics, and you are a wealth of knowledge. And people, don't let all these numbers
Yeah.
blow you over, because every time Keith and I talk and we're talking about all the things in our body, and don't do this, and take
Yeah,
this
yeah.
many milligrams and micrograms, and I'm like, okay, I want you to look at my labs and I want you to consult me. That's what I want to do, because I could spend a lot of time researching. I don't have that kind of time, and then I'm going to get it wrong, and I can't afford that either. So I'm anxious. We've got 3 clients that are already wanting you to review their labs, and we're going to talk about that over this next week. And I think that'll be a good lead into our show next week.
That's right. Yeah. So everybody has kidney issues. Okay. We're going to have kidney issues rather. And so therefore we need to be paying attention to these things, making changes.
Go back and review your labs and look at the kidney numbers on your labs. And if you see that trend, let's see if we can't stop the trend.
right.
I mean, all we have to do is understand that's where we're headed. And there are things to do that we just are not aware of.
Right.
So anyway, Keith with prevailovercancer.com, Paul with hyperbaric.plus. Come see us, get on, send us a note, send us a question, because we're going to take off on this next week, and we're going to have a really good game plan. I'm going to see if I can maybe have some of our clients that have shown an improvement by the things that we're already talking about, and see if they can be here, and maybe we can hand off to them this next week.
Okay.
I think
Sounds
this is super important.
Yeah.
And with all the toxins we're taking in today,
Toxins
that's what's killing our
go
kidneys.
through. Toxins are removed. They're changed by the liver to water soluble and urinated out. And if we don't change that appropriately, or if they're overwhelmed, the kidneys are going to be damaged by those chemicals.
You said a couple of things to me that people's kidneys disappeared.
Yeah. They disappear.
We can't do that. I mean, we got to know that we're going downhill before they disappear and
That's
try to
right.
rescue them. So anyway, real important. Look forward to seeing everybody next week. Thank you again, Keith and Josh with ultrabotanica.com. And look forward to seeing you next week.
Great.
Thanks again.